Let's talk lateral lunges during pregnancy. Should you do them? Should you modify them? Or just plain avoid them? Well, like everything to do with pregnancy, the answer kind of lies somewhere in between. And while I'm a huge advocate of lateral work, and I personally use this all of the time for my postnatal or general pop clients, I don't program and I personally don't recommend lateral lunges during pregnancy, and I'll tell you why. But first, to help you understand my reasoning for this, let's take a high-level look at the anatomy of your pelvis. So you have your two hip bones, also known as your pelvic or innominate bones. So joining these two bones at the front of your pelvis, you have something called your pubic symphysis. And at the back, you have a joint called your sacroiliac joint, or SIJ. And without going too deep in the weeds, it's really important to know that the superficial fibers of your linea alba insert into your pubic symphysis at the front of your pelvis. And your pelvis is also one of the most important joints in your whole body, as it's the central point between your upper and lower body and has to absorb, generate and transfer force between your upper and lower body. And that's not to mention that some of your strongest muscles actually attach into your pelvis. So to do all of this, it needs to have a certain amount of movement within the joint itself, natural movement, right? When it comes to pregnancy, you always need to take into consideration a number of different factors and how they affect various parts of your body. But I'm going to talk about three things in particular here and how they can impact your pelvis. So you have your change in center of gravity, you have ligament laxity and increased pressure. And bear with me here because, like all of my videos, they eventually tie back into why I don't program lateral lunges during pregnancy. So increased ligament laxity may actually cause a small increase in the natural range of motion in your pelvis, meaning the ligaments that usually hold it really tightly together are softer and allow more movement than pre-pregnancy. Now, if this increase in range of motion is not then countered by strength in the muscles that support your pelvis, like your glutes and your core and your pelvic floor, of course, this can then lead to pelvic pain. But it is important to note here that the research has not established a link between relaxin, an increase in range of motion at the pelvis, and specifically pelvic girdle pain during pregnancy. They do, however, know that women with pelvic girdle pain during pregnancy have increased pelvic, thoracic, and lumbar joint mobility. Now, from a postural or muscular biomechanical kind of perspective, you have the change in center of gravity, transferring force into your lumbar spine. Now, this causes excess stress in the lower back and pelvic girdle. So this extra force and stress has an effect on the strength and coordination of the muscles that support your pelvis. So with the muscles not working as well as they should, they actually have less ability to counterbalance the laxity in the ligaments. Then, of course, on top of all of this, you have the internal pressure being placed on the pelvis from the increased weight of the baby, your uterus, the amniotic fluid, the placenta, etc., etc., etc. Now, given all of this, it's really no wonder that studies show the incidence of pelvic pain in pregnancy is anywhere between 48 and 71%. Now, if you had lower back pain or pelvic pain or a history of trauma to your back or pelvis prior to falling pregnant, or you've gained a lot of weight, you're carrying multiples, or your job is physically demanding, you're at an even greater risk of developing pain in your pelvis during pregnancy. And it was only recently that I was having a conversation with an extremely fit, very healthy woman who was only just out of her first trimester, who's in so much pain that she can't train lower body at all. I mean, for the time being anyway. So while pregnancy is super individual, from my perspective, when it comes to lateral lunges and the pressure that they place not only on the pubic symphysis at the front of your pelvis, but the SIJ at the back, due to that really wide and open stance of this movement, I typically tend to err on the side of caution, and depending on what's going on with the individual woman, we'll program other exercises to target those muscle groups instead. And you know, I have some clients that due to pelvic girdle pain can't even tolerate single leg work without pain. For these women, I typically use B stance or bilateral work only. There's no way that I'm going to program a wide lateral movement for this type of pregnant woman. I have some women who are okay doing, say, supported adductor work, they're fine doing B stands and some single leg work, but the moment they have to stabilize in one leg and do, say, even a lateral skater slide, where they stabilize on one leg and laterally slide the other leg out, they immediately get pain. Now, others have zero pelvic pain and are totally fine doing single leg work. But for these women, it's still really unlikely that I'll program lateral lunges, because while they're okay doing single leg work, I want to err on the side of caution and make sure that they're able to continue doing single leg work into their later stages of pregnancy. So I will program things like a lateral skater slide, which is more based on stabilizing while incorporating lateral work where there's no weight bearing on the leg sliding laterally. Or things like cable abduction, which is a staple lower body exercise that I program for women who are able to stabilize on one leg without pain. So like everything to do with pregnancy, it's totally individual and can change from month to month, week to week, even day by day. But the ultimate goal is to keep moving, keep training, and keep you as strong, stable, and pain-free as possible as your pregnancy progresses. So you enter your 4th trimester and life beyond as a new mum feeling strong and confident, which is why everything to do with the pregnancy process is based on individualization rather than one size fits all. So that's it from me today. I hope this video helped, and of course, if you'd like more in-depth pregnancy specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.